On the 6th of January 2022, the Lagos State Governor, Babajide Sanwo, commissioned the Thani Oladunjoye Old People's Care Center at Owode, Ekpe. This center, which is the first of its kind in the history of Ekpe, is a private initiative of the Thani Oladunjoye family. Now, with activities at this center in full swing, we at Eko Hot Blog are right here to take you into the center to get a feel of the center, the facilities and its personnel. Please come with us.
God helped us to build it, we commissioned it, and it's running. And it's running as expected. Okay, what we had in mind conceiving it is to give Medicare or Medi-Aid to the aging people, for them to see doctors, specialists, to examine them, and give them prescriptions, and for us to give them medications, and then for also give an ambience for them to recreate, rehabilitate, and then enjoy themselves.
It's okay, very, very okay. This place is very, very okay. The rapport of the staff is fine. They are fine. They treat us as an elderly person, so they are okay. If I am saying something about this hospital, I don't know what I can say much, but due to be praying for the person that brought it to Ekpe, because today now, this is the first time of coming here. When I had the news that about the hospital, about the center. So by the time I came here this morning, we are welcomed in a polite manner. Those working here, so they welcome us. So they arrange it very well. So every one of us entered the room, consulting room, to see each doctor. So after seeing the doctor, written the prescription drugs we are going to use for us. So now we are waiting to see pharmacists to collect our drugs.
This is my first time to come, but as I come, I see everything. I thank God. I thank God, and I pray God to help the person who bring this thing. He will prosper. Anything where he need in life, he will get it. Because he want to help poor people. I want God to help the man. And you are people where they work here. Anything you want, God will give you people.
The turnout was very impressive. Very, very impressed. And they used to come in. When they come like that, they will take the card from the reception. We issue them the card. After we issue them the card, we now direct them to go and see the doctor in consulting room. We have 2 consulting rooms. We have consulting 1 and consulting 2. That's where they will see the doctor. After the doctor attending to them, we now direct them to the pharmacy to go and take their card, to take the drugs. After taking their drugs, they will take the drugs home. And we do advise them how to use their drugs, because they should use it accordingly so that it will be effective for them. And we do give them 2 weeks appointment for follow-up, and they used to come.
So they've been coming in, even though at first some of them does not really believe, they see it as one of these maybe government settings. When you hear them discussing, say that, no, let's just go there, because by the time they attend to 1 or 2 or 3 people now, they will tell you no more drugs. But by God's grace, they've really been surprised at what they are seeing, and they've been coming every Tuesday and Thursdays now. We attend to them.
I can tell you that some of them got here by 4 a.m. this morning so that they can pick what you call tally number. All right. So we are looking at that right now because our projection was that we would have 30 patients per day. But as you would see, there's no day that the doctors treated 30 from the inception. The first day, the doctors treated about 65 of them. The second day, 50, 52. The third day, about 50 something. Today, as you would see, about 48 of them, have been seen and treated and given free medication. Okay, so it's going on, because I'm not going to say totally because it's free. I'm going to say because there's a need for it. Okay, so people would always come. One of the things that we gave them, giving them, is that we have taken away the stress of them going to the hospital, okay, to queue amongst hundreds of patients. We've taken away from them that they are able to see doctors, they're able to explain, their situation to doctors. Doctors are usually not in a hurry to see them because fortunately, some of the doctors that we have passion. They are very passionate, okay, about the aging people. So they are quite receptive of them. They are quite patient with them because they have such knowledge and such experience before.
The people that make this place, they are my family. Almighty Allah will be with them. Everything they lay their hands upon will be proper. They will go higher and higher in life. They will attain the age of elderly person. They will not die young. In the name of Almighty Allah.
Torí pé náà ó yà wá lẹ́nu pé a mọ̀ pé irú eléyìí wọ́n lè ṣe irú eléyìí sí Ẹ̀pẹ́. Bẹ̀bọ́n dẹ̀ ṣe inú wa dùn gan. Lágbára Ọlọ́run máa gbé wọn sókè.
We have taken another appointment. Next appointment, some is a monthly basis, some are weekly basis. So after we complain to the doctor that this is what is worrying somebody, so before giving us another appointment. So this Thani Oladunjoye, the old age care, more prosper in Allah's name. They will not come down in Allah's name.
We don't admit you. We don't admit them just for them to see the doctor, attend to them, and go back home. But on Saturday, we told them to come for lecture. We have lecture room. They have Ludo there. They have Ayu and some other things that can make them happy. So that one is on Saturday. So we used to tell them to come on Saturdays. But that Saturday that are coming, there's no need for them to see the doctor. Just to enjoy themselves and feel at home. And we used to give them tea to drink. And they like it. They appreciate it.
The vision of this place is to give back to the society. And we are not expected to take anything from it. Neither will any staff try to do that.
I'd like to also add that we've been getting support from people around us in here. I'd like to mention a particular case of a madam that just walked in, okay, retired as a nurse from London. She worked with the aging and aged people in London, and she found herself retiring to Ekpe. And then before now, she's been doing something that is similar to what we're doing. So, getting to know this place, she just walked in and offered herself as a volunteer. Okay, with all that she has, with all the word of experiences that she's got, and what she had to offer us, I pushed her, how much? She said, no, I'm a volunteer. And she's been doing that with passion and commitment, beyond the call. Okay, she brings stuff from her from her house to keep this place going. So we get such support, and we hope we will. And she wouldn't like her name to be mentioned, but we don't know her, but God knows her.
You have heard from the senior citizens and personnel right here at the Thani Oladunjoye Old People's Care Center right here in Ekpe. Please share your messages and your good wishes in the comment section. From Eko Hot Blog, I am Lucy Ohiri. Please do not forget to subscribe to our YouTube channel and follow us on all our social media platforms. Thank you.